Congressman O'Rourke.
Thank you, Mr. Chairman. Commander Thine, I'd like to give you my perspective as a freshman member of Congress, new to the Veterans Affairs Committee in the House, and just thank you and your team and the members of the VFW for helping to make this a successful year for us and to get up to speed on the issues where we didn't have the subject matter expertise, meeting with our staff, the testimony from Mr. Kelly, Mr. Wallace, and others on the subcommittees on which I serve, and your feedback on legislation that we've worked on to improve that legislation has been invaluable. So I just want to thank you and tell you that it's made this first term in Congress so far very effective for us, and really appreciate what you and the VFW do. Of the issues that you brought up in your testimony, perhaps the most acute for the constituents and veterans that I serve is access to mental health care and to mental health care providers in El Paso, Texas. We serve nearly 80,000 veterans in that VHA clinic right now. We have had a very hard time fully staffing the manning table as prescribed, very difficult time recruiting and retaining mental health care providers. We've gone so far as I've personally called recruits, a psychiatrist that we were trying to hire in El Paso. We've worked with the local VHA to hold them accountable. We've had numerous meetings with Dr. Petzel to make sure that we're getting to that 14-day commitment that we have so far failed to do. We're working on legislation right now that would give psychologists the authority and the responsibility of prescribing, something that happens in the Department of Defense right now. And to Mr. Wallace's point about that being an easy fix, prescribing versus a comprehensive therapy, we understand that danger, but we also have a shortage in prescribers in El Paso. I think about when I was campaigning for this office, meeting a young, very young Afghan war vet who had PTSD, was in El Paso, didn't have family or friends or a network or roots in that community, was attending community college on his post 9/11 GI Bill, working in a restaurant at nights, told me he had PTSD and was supposed to see a therapist every week. He said he was lucky if he got in every 6 or 8 weeks. Every time he went in, it was a different counselor or therapist, so there was no continuity in care. And since then, since I've been in office, I've found that the problem is worse than we thought. We surveyed the veterans in the community. 25% who've tried to make a mental health care appointment were not able to make one within 12 months. So given some of the things that I've described that we're working on, what would you or someone else on the panel that's there with you, what would you recommend that we do in addition to what we're doing right now?
Good question. Seriously, there's not enough mental health providers in the country, and if I am one, I may not want to come to Texas. That's another problem, where they are. That's why this PC3 is positive to get. They have a network of mental health people that they used to use. Tri-West does. They used to be used in the for DoD or TRICARE. So you have a cadre of people there that can help them. But it's a difficult issue, and the other side of that is that we're very concerned that they don't lower the standards of what they consider a mental health professional. If I graduate today with a degree, a bachelor's degree in sociology, am I a mental health professional? No. I've got a long way to go to get to that degree. So we're also riding VA to make sure that they don't do that. But they've got to do more work with universities so that they groom people down the road. But that's not helping today in Waco or wherever, or in New Jersey or Connecticut or Wyoming. It's just not doing it today. It's a real serious problem, and I feel sorry for that veteran who's supposed to be seen every week. It's not being seen in 12 weeks. I mean, that individual's got some real serious mental health problems, and somebody should be watching him very carefully. And the VA's negligent by not seeing him. I mean, that's unacceptable.
And I'd just add that it's not exclusive to these young veterans returning from Afghanistan and Iraq. I've met with a PTSD support group for Vietnam-era veterans on several occasions. The shortcomings in access and capacity are being felt by them as well. And it really begs the question asked by the Senator earlier when we talk about meeting our commitments before we add additional services. I take it one step further, and I don't know that we can add additional wars and add additional commitments when we can't take care of the veterans who have served in the wars so far. And that's always present in my mind as we look at commitments that we're making around the world. So with that, I'll yield back.